glad that I get a space to actually talk about this. I'll try not to be too extensive, but I mostly just made like a 6-point list of like what I need to like consider, not just before I open, but before I see anybody. But like I kind of just went down the list as like, if any of them are not a great looking number, it's like, do not pass go, do not collect $200. Like that's the point I need to hit before I go to the next point. The first and foremost being, what does my local government say? By their standards, when is it possible for me to open? And that's mostly because I'm lawful good. I don't want to draw attention, especially because my state, Massachusetts, has been leading the cause for contact tracing. So I really do believe, like, if God forbid I loosened my standards too much, it would get traced back to me, and that would not leave a good impact on the community at large too. So I want to be mindful of that too. Unfortunately, there are people in my local area that have basically been seeing clients as if the pandemic isn't happening. So that really concerns me. There's not a whole lot I can do about them. And I don't know if anyone will ever hear me talk about this, but like, I'd want them to stop if they can. I understand that these are hard times, so that might not be possible, but like, I do care about like people's health a lot, and it's like, okay, money is definitely important, but it's not as important as being like, it's not very helpful if you're dead. That's to be very frank. But then after that, so for me in Massachusetts, like they actually opened phase 1 today. By looking at the standards, I saw that dentists open up in phase 2, and I've been using them as a general reference for when to close down before, because they are the most at risk for exposure to diseases. However, they usually wear masks, so that's something to consider. I personally, I don't plan to open my doors if I have to wear a mask, so that's a big factor that I need to consider. I just don't feel like it would be comfortable for anybody. I may end up adjusting the sessions dramatically to the point where they really wouldn't be cuddle sessions anymore. It would be like a professional back scratching session. But like, that's something I'll have to consider as it gets closer, seeing what the need is. I mean, maybe it is that works, but that's something to consider too.
Sam, can I just tack on to that?
Yeah.
Like, you've been following dentists. I've been following massage therapists.
Yeah. They're both very high exposure to that. So I'd say they're both pretty good on that front. From what I saw with like, I think it was like American Board of Massage Therapists, they haven't really come to a consensus, and they just sort of deferred back to the state boards. So that's something to consider as well. But that's my big thing, is like, what does my local government say, and what are their standards, and do I feel comfortable with that? So once the local government is like, yep, you're good to work, you can do this, here's our standards. The next one I want to consider is like, what does testing in my state mean? I've been following a pretty notable like immunologist in Massachusetts that's been tracking a lot of like the testing procedures. In general, what they see is like, if there's over 5% of the tests are positive in your state, chances are they're not testing enough. They're missing a lot of like confirmed cases, and there's going to be a greater risk of spread. So even if like, it's like, oh, like, yeah, like there's only X amount, like the X number of cases in my area, if it's still a high percentage to like the number of tests overall, that's not usually a good sign. So I kind of look at it less about like how the overall number looks, and if the percentage is too high, what the orders of magnitude could be, as we just don't know what we don't know in that front. So that's number 2, is like, okay, if we're like around 5% or a little bit lower, that's probably a good sign. Number 3 would be like, what's the predicted worst case mathematical situation? Can I screen share actually? I might want to be able to do that, because I have a site that I actually really like referencing. So this one is for Massachusetts. This is covid19.healthdata.org. So this is what's the predicted worst case mathematical situation. So I'm going to scroll down a little bit. So I've been very mindful. The reason why a lot of the social distancing is happening is mostly to reduce hospital resource use, but also to reduce deaths. But that was the big concern, was to flatten the curve so that our healthcare systems weren't exhausted. So this is the curve for Massachusetts in particular. So where we are right now, yes, we're trending downwards, but if you see the shaded area, that's a percent of uncertainty that like, we don't know what we don't know. We can't account for humans being humans and doing their own thing. So there's still a chance, like these are the predictive models, but there's still a chance that it could spike up that high. So right now, where even though they're opening right now, I'm like, it's still possible to spike up to our highest amount. I don't feel good about that. So I picked June 8th kind of arbitrarily before because it goes a little bit further down, and yeah, the risk is still high. The cases that are low, I'm gonna have to take a look as I get closer to that date. But that's one that I would feel confident in, like at least saying that there's a possibility I might open. The next one that they had for phase 3 would be like June 29th for Massachusetts. So that's way, way over here. The risk is going way, way further down. So that one feels a little bit more comfortable. And for comparison, March 23rd was when they ordered all essential businesses to close down. So this is what it looked like back then. It really hadn't gone off that much. They just started to multiply and they got nervous. So they started shutting people down back then. But yeah, highly recommend looking at like your predicted worst case scenarios for different times. They do update all the time because humans are humans, so they have to track what's going on constantly. So it could flatten, it could spike, we don't know. So keep tracking that to see, we could get a feel for that. So that's number 3. So the next 3 are more things for like both me personally and then also my client. For number 4, the question I would be asking is, where have I been for more than 10 minutes in the past 2 weeks? Especially in closed spaces, I'm more interested in, because with lack of airflow, there's a greater chance for virus particles to get transmitted. That's also why I'm kind of nervous about opening my doors when the risk is still very high too, because I don't really have much of airflow in my own space. But it seems that if you spend 10 minutes in a space where you could be infected, be it with like another person that's nearby, chances are it's safer to assume that you probably are a carrier, whether you have symptoms or not. Because it seems to be getting pretty high right now, at least right now. So that would include like grocery stores, takeout restaurants, office buildings, doctors' offices, spas, pharmacies. Public restrooms are a huge, huge, huge risk. But those are things to keep in mind. Like, have you been there for more than 10 minutes? Like, if you're close to that, might be hard. If you don't remember, if you're not sure, especially for the past 2 weeks, Google Timelines under Google Maps, you can actually track like where you've been and for how long for periods of time. I can throw that link up in our group chat too.
Oh, yes, please.
Yeah.
Damn, I love that.
Yeah. Side note, I use that for my mileage tracking too, because I'm terrible at tracking that for my taxes. 5 is, have I been wearing a mask correctly whenever I'm risk exposure? So in Massachusetts, they've made it like wear it whenever you're outside at the home. In your area, it might be like when you go to public areas. I don't know what the standards are for each area, but like that's generally what I've been abiding by. As a general note, what they've noticed is like it only takes about 1,000 viral particles to get infected. That's really not a lot. So the thing that I've noticed is that, do I have my mask? I've noticed that there's a lot of people that will walk around covering their mouth, but their nose is just sticking out. And I'm like, it's the equivalent of like wearing a condom, but then like clipping off the tip. Like that does absolutely nothing.
That's such a good analogy. You're so right.
Yeah, I definitely stole that from a meme, but like it's just like you're doing it, but there's no point to it now because you're not really actually helping. And another thing is like the masks are less about you not getting infected as much as containing if you are infected. So like that's why it's really important, especially if you're not sick, because if you're asymptomatic and you just happen to cough, it blocks a good portion of it. It's not 97%. It's like one of the memes that going around is, but it's quite high. So that's number 5. The very last one, and probably the most important for me, is there anyone you would want to avoid right now, like the elderly, to avoid the possibility of infecting or getting infected? Basically, like, this is more for my clients than for me, because it's like, oh, I'm coming to see you. I actually had somebody call me like this weekend asking for a session. I'm like, this is really tricky. He's like, well, have you been quarantining? Have you, like, I haven't seen anybody. My main thing though is that I need to see somebody that has done a good job quarantining, because I'm going to see my elderly parents and take care of them in 7 days. And I'm like, absolutely not. Like, if there's people that you are trying to protect in this, like, coming for a cuddle session is not a good idea. Yeah.
I mean, not in 7 days. Maybe if you were going there in 14 days and you had time to self-quarantine before that.
Yeah.
But heck no.
Yeah. And this is the toughest part, is like, I've noticed like so many people I've talked to have been trying to justify anything that they can in their own head so that they can be like, well, I can come in for a session. So I've been really like stringent on this list in particular, because it's like, it's my litmus test to see who's been paying attention. If they undermine it, like, this is my boundary. I'm like, I'm not budging on this. Like, I have to go by this. I'm not accepting anything less than that. So that's more or less my little litmus test of like what I'm planning on paying attention to as I'm moving forward. It's not perfect, but it is a piece to at least filter through and see who's taking this seriously, who's not, and also how I can move forward and when I can move forward too. Thanks for listening.